Hello, my name is Priscilla and I am a registered nurse. I am here to show you how to give your medication in the Mini Bag Plus method. This is what a Mini Bag Plus is. We are going to go over all the supplies that are needed, how to give the medication from start to finish, and then talk about your PICC line and midline IV care. First off, a Mini Bag Plus is a method that we would give in the gravity setting. So the supplies include the Mini Bag Plus, which has the medication vial attached to it. Includes the tubing. You have your flushes, saline flushes, and then you have your heparin flush, which is meant for an anticoagulant. You will be also given alcohol swabs, gloves, and all the supplies that you need for your IV administration. So Mini Bag Plus medications, they do vary. The most common medication that we give through Mini Bag Plus would be ertapenem, ampicillin, and you definitely want to follow your doctor's order when giving the medication in terms of frequency and for however long that you need it for. All right, so all the supplies we went through, you will be given a week's supply of medications at a time. Because the medication is in a powdered form, you do not need to keep this in the refrigerator. So I would leave everything out in a clean surface area, and you want to keep it away from children and pets. So when it's time for you to actually give the medication, what you want to do is you want to create a clean working space. Make sure you wipe everything down, make sure you wash your hands, and then we'll go through the steps how to do this. So with the Mini Bag Plus method, you do need an IV pole. I don't have one at this time, so we're going to use my hooks and pretend it's a pole, and we'll go over how to do this. All right, let's start with the beginning. So the first step is to make sure you lay everything out. Everything that you see here on the other screen is what you'll be using. It's a one-time use for everything that you use. So dispose of it, and then you're going to grab a brand new set the next day, the next time. So once you have everything laid out, what you want to do is wash your hands. We're going to use hand sanitizer, but when you are doing this at home, please wash your hands for 30 seconds. That's 2 happy birthday songs. After you wash your hands, you may wear gloves. You also will be given IV covers. So on your PICC line or midline, the hospitals may have different colors, but ours are green. These are green Keros caps. So they're just meant to keep your IV clean and covered when you're not using it. All right, so before we hook up your medication to the IV, we do want to get it prepared. I do have 2 different sets of instructions. This instruction right here is a picture format on what you have to do, and so we'll go through it step by step. First thing we want to do is mix the bag. So the bag comes just like this. It's already attached to the bag with the vial. So in order to mix it, what you want to do is you want to break the seal right here. So I'm going to break the seal. You might hear a snap. Okay. I'll show the other view here. You want to break that snap on the blue end right there. This will allow the liquid to go into the vial. So to mix it, what you want to do is you want to squeeze the bag so that there's fluid coming into the vial. You want to fill it about halfway full. Let me show it in this view so you can see it's halfway full. And then you want to flip it upside down and you want to mix the medication. It might take a couple minutes for it to completely dissolve, but you definitely want to make sure that there's no chunks and make sure it's completely dissolved and it's a fluid. All right, once you mix it, we want to put the medication in the vial into the bag. In order to do that, you want to keep it upside down, and then you want to squeeze the bag so that it creates that pressure where it brings it from the vial to the bag. You can see it's already going inside. And as you can see, it's empty. The vial is empty. Now the bag is full. Once you have it full, you want to just make sure it looks good. And that is how you mix the bag. The second step is to connect the tubing to the bag. Let's talk about the tubing first. So this is called a dial-of-flow tubing. It's a gravity tubing. There's two different ends. You have this end, which goes to the bag. There's a spike in that cover there. And then you have this end, which goes to you, to your IV line. So before we connect to you, we are going to connect it to the bag. To do that, we want to take off the cover of the spike. Make sure you don't touch anything with the spike. We're going to take the bag and we're going to insert the spike to the bag. So to do that, we're going to pull down this blue cover. This is what the blue cover looks like in the other camera view. So we're just going to pull this down. And then we're going to insert the spike to the bag. So the spike is what's breaking the seal. You can see there's a spiked end, goes into the bag. Once you do that, you do want to make sure that your clamp is closed. So there's a closed clamp. You want to make sure the dial's to off. Once you connect it, you can hang this on your IV pole. So we're going to pretend that's my IV pole. Before I do that, I do want to show you what the chamber looks like. So once you connect the spike to the bag, you do want to squeeze the chamber a couple times. And you want to make sure it's halfway full. Do you see how it's halfway full right there? Yep, keep squeezing. All right, once the chamber is halfway full, let me show you in this view, then you can hang it to your pole. All right, so the next step is to prime the tubing. Priming the tubing means to get rid of all the air in this brand new package that you have. To prime the tubing, you do want to make sure that the dial of flow is open. So you want to look at the flow here and you want to turn the arrow so it's open. Okay. And then you want to make sure you open up the clamp. Once you open up this clamp, the IV pole would usually be higher, so I'm just going to hold this higher because it is going to prime by gravity. I like to keep a paper towel to keep this from leaking and getting a mess. So I'm just going to grab something to put the fluid. You want to prime so that a couple drops come out of the end there. And with the cap, it's still going to leak. So you definitely want to keep a paper towel or something so it's clean. All right, so to prime the tubing, we're going to open up the clamp here. So you can see there's medication flowing through the tubing. It's going to flow through the tubing. And I like to use this clamp as a quick clamp to close off so it's not spilling everywhere. So you can see the medication is going through the tubing. And like I said, we're going to wait until a couple drops come out to ensure that there's no air bubbles or anything. I'm looking at my tubing. I don't see any air bubbles. Okay, almost there. All right, once you have a couple of drops that reach the end of the tubing there, I am going to clamp this off so it doesn't spill everywhere. I'm gonna put this back in my pole there. Okay, so that's how you get the medication ready. The medication is ready to go. You do want to change the rate of your dial-of-flow depending on your order. So please talk to your nurse or your doctor about what rate to set it at. Sometimes I think the common rate that people set it at is between 200 and 250, but like I said, please talk to your doctor. Okay, once you have the medication ready to go, we are now going to touch your IV line. So I'm just gonna hang this right here on my pole. All right, so now it's time to touch your IV. Before I do anything with my IV, I like to wash my hands again because we're now touching your line. So hand sanitizer, wash your hands for 30 seconds. If you were wearing gloves before, take it off and then put a new set. Okay, so we're gonna go through my second set of instructions, which shows you how to connect and also flush your IV. So the first step is you want to unclamp your IV on your PICC line or your midline. You may or may not have a clamp. So if you do have one, definitely just slide it over or undo it. If you don't need to worry about it. So we're gonna take the green cap off. The first step is to clean your IV port with alcohol swab for 15 seconds. You want to scrub the hub. That's one happy birthday song. Okay. Once you're done cleaning the IV port, we are going to flush to make sure that the IV is good to go. So to do that, if you look at my flush there is an air bubble at the very, very top. You do want to make sure you get rid of the air bubble before you flush. So I'm going to take the cap off. You got the air bubble there. Okay, we're going to connect it by pushing it in and twist. And we are going to we're going to flush via push-pause method. So we're going to push, pause, push, pause, push, pause, push, pause. And it should go in pretty easy. When you're done, we're going to clean again. Clean in between. Clean for 15 seconds or one happy birthday song. The next step is to hook up your antibiotic. So we are going to take the IV line. It's already ready to go. And take this. Connect. Now that your IV is all hooked up, we are going to open up the clamp so it runs effectively. So I'm going to make sure there's no knots, no kinks on the tubing here. And then the clamp that we use to quickly close, we're gonna open. So what you wanna do is push open. And now it's gonna go in effectively. So you want to look at the bag after you open the clamp. You wanna make sure that it completely empties all the way to the bottom. And typically the bag will take about 30 minutes to an hour to infuse. So before you go home, your pharmacy and your nurse will be able to tell you how long. And they'll also be able to tell you what to set the rate at. Okay, so after the IV is finished, now we're going to disconnect. If you are going to reuse this tubing again, the tubing can be used for 24 hours. So if you have multiple doses in a 24-hour infusion, you want to reuse the tubing. So to do that, we want to grab a red cap that we'll provide for you. Cover the end of the tubing so that you can reuse it again. And then you want to save this on your pole for the next time. Now we need to clean your IV. So we're going to clean with alcohol swab. 15 seconds. Flush afterwards. So take out the air bubble. However, I do want to show you what it looks like if you forget to take the air bubble out. So what you want to do is you want to push it in. And if you forget that you forgot to take the air bubble out, turn the syringe so that the air is on top. And when you do the push pause method, do that until you see the air bubble and stop. So there's two ways you can flush. You can take the air bubble out first, or you can go this way. When you're done, disconnect, clean again for 15 seconds. And now we're going to do the heparin flush if your doctor prescribed it. Like I said earlier, your heparin is a blood thinner. It prevents buildup from happening in your PICC line. And that's the reason why it's the last flush of the day, because it's there to keep your IV coated when you're not using it. Okay, when you're done, clean again for 15 seconds with an alcohol swab, and then you want to apply a brand new green cap. If you have 2 IV lines or 3 IV lines coming out of your PICC, you definitely want to flush the other line. So what you want to do is you want to grab a set of saline and heparin, and you do the exact same thing. You want to clean, flush with saline, clean, flush with heparin, clean, apply a brand new grain cap. It's for daily maintenance, and it's a backup line in case your other line stops working. If you have any issues with your PICC line or with the medication, please call your nurse or your doctor, and they can guide you through. In regard to your PICC line, please keep it clean and dry. Cover it with saran wrap in the trash bag if you were to shower, and do what you can to not get it wet. If it gets wet, you must call your nurse right away because you don't want to get an IV infection. So please look out for swelling, redness, any pain when it comes to your IV line. Thank you, and thank you for watching how to give your bag in the Mini Bag Plus method.